So diabetes is becoming an increasingly epidemic-sized proportion, and the World Health Organization in 2004 predicts that by 2030 there's going to be over 366 million people with diabetes in the world, and for comparison's sake, there's only 311 million people in the entire United States of America at this point. So this is going to be a really, really big burden that physicians are going to have to face. And the fact that diabetes in and of itself is increasing is a problem, but on top of that, it's the lack of control with these patients. These patients are just not being motivated. And so all of this sort of on top of each other is promoting problems with peripheral artery disease and with symptoms like GI pain. So we're going to be seeing a lot of this, and with an increasing elderly population, and we know that diabetes tends to occur, at least in developed countries like the United States, in older individuals, we're going to be even facing this at a higher incidence. So peripheral artery disease in patients who have diabetes tend to have a much more uniform and widespread and a much more aggressive form than those patients who don't have diabetes. And in patients who have diabetes and peripheral artery disease, they tend to have a higher mortality rate, higher rate of major amputations. And so it's important to try to capture all of these issues in these topics to try to train people who are at the front line to keep an eye out for these things, because prevention and early aggressive treatment really does show the best benefit of promise for these patients. So one of the greatest tools that we have right now for diagnosing peripheral artery disease is the ankle brachial index, but we don't routinely use that alone in measurements. We look at the big picture, of course, because in patients who have significant atherosclerosis and who are diabetic, even if you have a high ankle brachial index, which would mean it's normal, it could actually be a harbinger of something worse, meaning that these patients have such bad atherosclerotic disease and calcification that it actually may end up being normal on an ABI, but actually is worse than what we would call the cutoff for a diagnosis of peripheral artery disease. So treatment for patients who have peripheral artery disease really depends on the severity of their condition. And we typically like to start with lifestyle modification changes, and we want to make sure that they're in a good exercise program, a structured program. We want to make sure that they see a nutritionist, and absolutely to prevent a progression. It's been clear that cigarette smoking has been linked to it, and halting cigarette smoking can really help decrease the progression along. And then depending on the amount of problems that they have, we go on with pharmacological agents. We want to make sure that they have tight blood pressure control, they have their cholesterol levels in check, and that they have their glucose levels in check. And then from there, more refractory or more difficult cases to control, we think of things like surgery or spinal cord stimulation.